first, I'm going to walk into the patient's room and introduce myself. I would say, hi, I'm Savannah. I'm going to be your student nurse today. I'm going to assess their overall condition, assess if they're able to cooperate and hold still during the procedure today. I'm going to assess if they're able to lay supine and flat with their head laying flat. I'm going to assess and ask when they last voided, assess the bladder for any distension, and I would also bladder scan them for any fullness within their bladder. I'm going to verify their name and date of birth. So this is Carl Shapiro today, and his date of birth is 7/19/19XX, and he would verify that with me. I'd ask him if he had any allergies, and he would tell me, but he has none today. I'm going to explain to Carl why we are inserting a catheter, why it's necessary, and how he can help cooperate with the procedure today. I should have performed hand hygiene when I came in, but I didn't, so now I perform hand hygiene now. And we do not have any hand sanitizer, so we're using alcohol pads. Okay, I am then going to raise my bed to a waist height. Okay, Carl, today I provided privacy by shutting the door for you. This is going to be a little bit of an invasive procedure, and if you feel any discomfort at all, just let me know. I'm going to pull the blankets down over his feet, and then I'm going to pull this up. Okay, I'm going to perform hand hygiene. I'm going to grab my kit. Okay, well first I would have abducted his legs out. And from hand hygiene again. Alright, and now I'm going to set up my kit. I'm going to open this flap away from me. These two out. And then this one this way. Alright. Ground loose. Are you able to help me lift the butt? Can you help lift the butt? Wheel. Okay. So I did cross over my sterile field right there to get that under there. That would be considered contamination, and I would start over. Perform hand hygiene. So I touched my shirt. Alright. I'm going to open that back up. Pinch my sterile gloves. Over there. Okay. I'm going to come over here and I'm going to perform hand hygiene prior to opening my gloves. Now that I have my sterile gloves on, I'm going to come over here and get my sterile field set up. I'm going to take this and like that. Okay. So first I am going to remove my betadine. I'm going to put it over the cotton balls. Discard. I'm going to get the lubricant and put it in here. Discard. I am then going to get my syringe and hook it up to my catheter. I'm going to take the top piece of my catheter and put it in the lubricant. And then I'm going to place it back in here. Okay. Prior to beginning the validation, we would want to perform any routine peri-care on Carl before we do the catheter. Then we are going to clean his penis with our cotton balls. I'm going to firmly grip him and clean in one circle. Clean another circle. Discard my last cotton ball. And that. This is my non-sterile hand, so I'm going to keep it positioned on here. Alright, so after I perform our care cleaning it, I am going to insert my catheter in the loop. And I'm going to, insert the catheter into it. While I'm inserting, I would have him take in a big deep breath, and then I would insert the catheter while he's exhaling. I would ask Carl if he's experiencing any discomfort, and if he was, I would immediately pull out. I'm going to insert the catheter until I see urine, and once I do, I would go 1 or 2 more inches in. Okay, so I'm going to inflate the balloon with my sterile hand. I'm going to give it a nice firm tug. Inflated the balloon, I'm going to pull this up to my dirty hand and twist it and discard. Okay. And then going to get a piece of tape. In real life, I would have tape already by me and ready. My assistant has to go get me some tape. Thank you. So I would tape this to his inner thigh, like so. Then I'm going to bring his bladder bag down and let gravity help us. I'm going to put it right in here. Once I have inserted the catheter, I would document the size of the catheter. I would look in the bag and look at the urine color, the clarity, the volume that was in it. And I would document all that. I would also document any peri-care that I had performed today. All right, I'm going to clean up all my supplies. Remove my sterile gloves for hand hygiene. I'm going to lower my patient's bed. I would ask Carl how he tolerated the procedure, if he's in any pain on a 0 to 10 pain scale. I would lower him all the way down to the floor. And I'm going to cover him up and put his blankets up, keeping him comfortable, and then I would be done.